It's a very good health plan. It's an excellent health plan.
And it turns out San Francisco's more than 400 laid-off workers will get to keep that health plan for up to 5 years while the city pays the bill. It's a benefit some local lawmakers didn't know about.
It was something that I was unaware of before that hearing. I don't think a lot of people were.
Supervisor Sean Ellsburn points out the problem. With 409 laid-off workers costing the city an average of $790 per month for health care, the city would pay close to $4 million over the course of a year. But with 2 more rounds of layoffs possible by July, suddenly the city's cost a year from now could be closer to $9 million. It's why Supervisor Ellsburn is proposing something sure to be unpopular, reducing those benefits or asking laid-off workers to pay for them.
It's the phrase kicking someone when they're down. And absolutely we recognize that. It's just a question of, is there an alternative, for example, COBRA?
San Francisco's head of human resources says the city is the only agency in California that keeps paying employees health care for years after they're laid off. She said it's a benefit that costs the city a lot of money, but it's also one that would be very difficult to change.
It would certainly involve negotiations with the labor organizations. It would involve the Civil Service Commission.
But HR Director Mickey Callahan agrees the city needs to look into it. For one thing, she says, this expensive holdover health care is easily abused if workers get a job somewhere else but keep taking city benefits.
They're supposed to certify that they are not receiving benefits from another source, but it would be impossible for us to know.
Ellsburn has asked for a study on how much this health care really costs the city. But since a change would take much more than a stroke of the gavel, it's likely those benefits won't go anywhere for at least a year. In San Francisco, Jonathan Bloom, KRON 4 News.